covered the questions that you want, if you've already covered them,
give her the microphone.
then that's fine. But does anybody want to put a hand up? Yeah, could you stand up and identify yourself,
Thank you, Lady Chair. I'm Dr. Sunil Nair. I'm a consultant cardiologist at Norfolk Norwich Hospital. I've got a question about healthcare, but if you'll bear with me, I just want to give you a brief outline of the current state of play healthcare-wise. Just to give you a bit of...
does this relate to planning?
Of course,
Oh,
without a doubt.
sorry.
It will give you a bit of an idea of how the planning and the lack of planning in terms of healthcare will impact on all of you. So, for much of 2014, the Norfolk Norwich Hospital, which is the only hospital that serves this county of more than 1 million people, has struggled with capacity and lack of beds. For the last 3 months, the hospital has been on alert with operations cancelled on a daily basis, and on an extreme occasion, a major incident was declared. Now, a major incident is usually something which happens if, for example, a plane falls into a village, killing hundreds of people, or a terrorist attack with bombs. You close all routine procedures so that you can divert all the care towards caring for the emergencies. Now, we had to do this over the Christmas period simply because of the relentless increase in demand for healthcare services. Now, I know myself of huge housing developments in Heatherset, Wyndham, Little Melton, Blowfield, Brundle, Cringleford, Thorpe St Andrew, Cromer, Dereham, Cosy, Chapel Brake, Little Plumstead, Attleborough, Poringland, Framlingham Earl, Mulbarton, Sprouston, Swaffham, Fakenham, North Walsham, Wroxham, Great Yarmouth, Wells, and recently 1,800 proposed houses in Long Stratton. That's just the major housing developments. Now, despite all of these extra houses and the increase in population, the hospital remains exactly the same size. At some point in our lives, we're all going to require the service of the hospital, whether it's happy news, such as a new baby, or sad news with a diagnosis of cancer, heart disease, or dementia. Yet no provision is made to increase the size of the hospital or number of beds. We frequently see on our local news ambulances queuing outside the hospital or not even arriving at an emergency. The hospital opened in 2002, already 10% less in size in terms of bed numbers than the hospital it replaced. And it seems to get no consideration in any of these multiple housing developments in the county. I frequently hear from neighbours and my patients that they have difficulty getting a timely appointment with their GP, often waiting up to 3 weeks. Only last Friday on Radio Norfolk, the practice manager from Watton Surgery, Mary Osborne, spoke of the problem of major development, the results of which were they had to deregister 1,600 of their patients, which effectively means they picked at random 1,600 patients and took them off their GP lists just to fit new people in. As well as closing to new patients because they cannot fill their GP vacancies. There are currently 56 GP vacancies in the Norfolk area. It takes more than 10 years to train a GP and more than 20 years to train a hospital consultant. So these vacancies aren't going to be fixed quickly. There's a national shortage of healthcare professionals and a big recruitment problem in Norfolk. Now, despite 154 documents in the planning submission, there are no reports from any health care services, GPs, dentists, hospital, community services, nor report from social services. It is simply assumed that a GP will be available, an ambulance will come when you call it, and that there will be staff and beds available at the hospital to save your life or treat you when you become sick. But there are no plans made in the proposals to make sure that this expectation will remain a reality. My personal view is that all housing development should be put on hold until there's been a commensurate increase in hospital and health provision to catch up with the massive new housing that has already taken place. Just today we found out from Roundwell Surgery that they're now losing 2 more of their GPs. They're going to remain open to new patients, but they don't know for how long that's going to be. And that's before all this new development happens. So my question is, what provision have the planners made for healthcare expansion, and what guaranteed funding will be provided for the hospital, community services and social care?
Thank you for that question. Healthcare is something that South Norfolk Council takes very seriously, and as a council they're engaging with NHS England, the Clinical Care Commission Group, and previously the Primary Care Trust. Now, as you say, you didn't see any documents that are identified in the planning process to plan for healthcare. Now, healthcare is run by central government, unfortunately, and when we get a planning application in, as we've had many times in the recent years, and people have raised concerns over doctors' surgery capacity, unfortunately we can't do anything under planning legal terms. I said earlier, under the development plan, to make developers provide healthcare facilities on site, put money towards healthcare facilities. Unfortunately, as it's centrally funded, we can't insist on anything with planning applications. But like I said, the council is working very closely with the healthcare providers, and we have met with Roundwell Surgery, I understand, and other surgeries in the area to identify what housing pressures we have to try and find space for, so they can then look forward to try and plan for healthcare. But unfortunately, it's not something that we can insist a developer gives kind of capacity for. One thing we do is when we know there are issues in the area with healthcare provision is we do kind of put the landowners in contact with the medical surgery and try and facilitate space to be found on developments for the new expanded healthcare facilities to go into. But in legal terms, we can't unfortunately insist that those healthcare facilities are provided, and it's unfortunate, as you say, that you express concern over the the capacity of surrounding healthcare. But it's not something, if we refused a planning application, for example, based on medical capacity, it would be overturned by the planning inspectorate and central government, because they would say that's not a planning consideration that you can take account of. You can only take account of ones that are in the development plan.
Can I add to that as well?
Come back to you on that.
Can I just add a bit to that? Yeah? Yeah? I mean, this isn't new. This came up at Parish Council meeting several months ago now, and we discussed it. Because COSI was saying that they couldn't take, that the COSI surgery couldn't take any more people if there was a big expansion here. And I know the Parish Council were in touch with Mattershall, and Mattershall said because there were extra developments that were coming up in Mattershall, I know they were fighting those, and in Dereham, they wouldn't have the capacity for people to go that way. And at that time, I took the information back to South Norfolk. We've got a senior officer who goes off to some of these other committees, the clinical commissioning one you were talking about, and also we have members who sit on health and wellbeing and public wellbeing, which are county-wide committees. So people are aware of this and trying to work alongside. I mean, these are the committees on high that are working alongside, that we're trying to keep informed and saying, look, we need these things. So, it's not just you, we are thinking about it, and I have started putting these in process. Just to let you know, we haven't just ignored it. Yeah?
But despite you thinking about it...
Well, the information is passed on for people to start doing something about it.
But we have had a number of developments in the area, some of which still are partway through, and there's no material change in things apart from people waiting longer for GP surgery, not being able to get an appointment, arriving at A&E, because there you'll be guaranteed to get healthcare, filling the hospital, patients can't get out the other side of the hospital, and it's gridlock. Same as the
I have experience of that, and that's why I've raised it, just as you have, just to say that I've already done the bit that you've just done. We're waiting for people to respond.
It may not be a legal requirement, but it's blatantly obvious. We will all need healthcare.
Exactly,
why are we building these houses just so that someone can have a home if we can't provide anything for them?
Yeah.
You put into the infrastructure roads. Why put roads? Because people need roads. Why put a school? People need education. Why is healthcare thought so lowly about that it has no legal requirement in any of this?
I can't answer that. That's why I raised the question. All I'm saying is, I knew what I was ahead of you, and I'd passed it on. Is all I'm saying. I can't answer it because we haven't. They're still thinking about how they're going to do it.
I'd like to have the luxury in my job of such a long thinking time. What will the planners make for healthcare expansion, and what guaranteed funding will they put towards it? You cannot make the developers ensure it, but you can recommend it. You can have safeguards in it that mean it has to happen in the same way that you put covenants on development. You say the developments can only have a maximum number of so many houses in the field. You have means of putting in stipulations that the developers have to follow by. And providing healthcare should be a basic fundamental.
I would say, reiterate my earlier point there, I don't disagree with any of the points that you've raised there. Like I said, and Councillor Dewsbury said, healthcare is taken very seriously by the Council, but if we were to put stipulations on to say no more houses to be built than this level, any developer would go to the planning inspectorate, and the planning inspectorate would overturn a refusal and approve it. And it's a national issue. It's not something that locally we could.
But local councils have to be seen to be firm to make a stand that represents the best interests of their democrats.
As Councillor said, we are working with the local healthcare groups, and we are going as far as we can on this matter without incurring massive costs for the local community. If we refuse something, we go to public inquiry and fight the appeal, and we lose costs. That's not the way to fight it. The way to fight it, as Councillor Dewsbury said, to engage with those professionals, engage with the people who come up with the capacity, and make sure that they're aware and that we're working with them to basically find the capacity.
Thank you. I'm sorry.
There is a clear statement in the design and access statement by the applicants that there is capacity in Cossey.
Yeah. Sorry, did you say who you were? I didn't. Sorry, you wanted to say something else.
The only thing I was going to add is...
Wait for that for a moment.
Is in terms of the way the housing numbers are worked out for an area, we start with the government's projections. So they...
Can you stand up?
Yeah. We start with the government's projections for housing. So we have to do something that's called objectively assessed need. We have to look at the government's population projections, so that's births, deaths, migration. We have to look at household formation rates. Those are the same figures that central government use to work out how they fund the NHS. So we have to deliver the housing. Unfortunately, it's down to different funding streams and different authorities to actually deliver the NHS services in parallel with that. But we should all be working with the same baseline figures.
Right, sorry, can the gentleman just say his question again, because we didn't hear it.
As I say, I think it's the design and access statement, there is a paragraph saying there is medical capacity down at Cossey Surgery.
That's what we were actually told at one point.
It certainly is.
Told at one point there was.
I think now it comes to the realisation with
Sorry, can you stand up?
Sorry. Obviously with the realisation with 2 GPs losing at Roundvale, clearly that statement is now flawed because this clearly proves that it unfortunately doesn't fulfil the requirement, and it's not just the GPs. No one's fought further ahead to the hospital, and surely as a council you've got the moral, you need to be morally correct into supporting. So right, you can buy a house, but sorry, no doctor. Further down the line, saying we don't want to waste money in fighting it. It's not really going to go down those people buy a house, is it?
No, but my point earlier about making sure we go for the best way of defending and providing healthcare was, as we said earlier, working with our partners, and that's what we're doing. And any statement in the design access statement, obviously we will be talking, we will review the situation as we know it, not just as something that's put forward to us in the design access statement.
There's one gentleman at the back there.
Yeah, I'm a new homeowner here. So, I understand there is arts and there is laws, but now you talk about something that's logic, and you talk something that seems to me logical. You have a problem with the healthcare system. You have a problem with the schooling system. You're definitely going to have a problem with the traffic. Because you're going to overwhelm, and actually you're going to tell these people that yes, you can buy a house, but coming back from work is going to be a living nightmare. And of course, that will apply to us as well. You're not going to have school. You're not going to have proper healthcare services. You're not going to have pretty much nothing from what we think that is valuable so we can continue having a proper life. And then you're telling me that all of that, no, we cannot do what is logical just because there is that law and that act. And you can do nothing about it.
Yeah.
Sorry. Do you want this lady to come back on it? Yeah.
I don't know your laws. I don't know how you do things here. I got that idea. I just want to...
Where are you from?
I'm from Greece.
Sorry?
I'm from Greece.
Oh, Greece.
Yeah, so again,
I
we don't
just
want to go back to that. The fact here is that I am a new homeowner, and I just want to get the basic idea that yes, logic dictates that these people will not be able to to live a comfortable life, and because of that, we will not be able to live a comfortable life, and we cannot go towards the logic direction just because of laws and that.
I think that's why we're here, actually. So you've summed it up. Thank you. Thank you to come back on that. Is there any other questions?
Yeah, my point is, looking on the plans there, at the showground, there's 2 parcels of land up there, and they've got them allocated for building on, and they use them for overflow car parks when the Royal Show's on, and when the Brownies and the Scouts Jamborees are all here. Where's all that traffic going to go?
Well,
and where's all that parking going to go?
Well, I'll answer that. Well, I can't answer it really. I have asked that question, and they assure me they have got plans, but they
What
didn't
sort of
tell me.
plans?
They didn't tell me.
Yeah, well, anybody can say they've got plans.
I think we've exhausted planning.